and thank you for joining our first of a kind virtual field trip. My name is Sheldon Yett, and I'm UNICEF's representative for the Pacific. Our virtual journey will start in Copenhagen at our supply division. Then we'll head to the Solomon Islands and then on to Papua New Guinea. But please stay on mute. This is important as we all need to hear our colleagues in the field. Now, I think as many of you know, internet connections can be challenging in the best of times, and they're particularly challenging here in the Pacific. But we're planning on crossing live to meet some of the team. Please type your questions in the chat box, and we're looking forward to answering them. My colleagues Shelley and Gina are assisting us with the visuals, so you may see their names come up on the screen too. So let's get started. Now, every year, UNICEF responds to around 300 emergencies. This year, COVID-19 has affected all of us. We're seeing escalating poverty. We're seeing supply chains being challenged to the fullest imaginable. We're seeing borders being closed, and we're seeing children being faced with very uncertain futures. UNICEF is working around the clock to get life-saving supplies to children and communities in every corner of the globe. You're about to see inside UNICEF's supply division in Copenhagen, the largest humanitarian warehouse in the world. We have over 1,000 supply and logistics staff who coordinate the procurement and delivery of supplies to over 190 countries, so children can stay safe and healthy. So let's cross to Copenhagen, where Heidi is waiting to start on our long journey. Heidi?
Hello, everybody, and welcome to Copenhagen and to the largest humanitarian warehouse in the world. This is where we store over 800 items for children. And on a monthly basis, we pack over 50,000 kits on the lines here. Today, as you see behind me, we have over 70 pallets of school in a carton. It includes health, water, sanitation, and hygiene kits. Here in Copenhagen, we have an emergency stockpile of supplies, including PPE, so we're able to respond very fast to emergencies. And this also includes our COVID response. So since the beginning of the outbreak in January, we've been shipping over 9 million gloves, 6 million masks, 500,000 gowns, and 250,000 test kits to over 90 countries as they respond to the pandemic. Some of our kits are shipped from Copenhagen, but actually 5% only goes through our hub here, and the rest goes either from the suppliers directly to our country programs or through our hubs in Accra, Singapore, and Shanghai, in Dubai and Panama. And as you can imagine right now, our Shanghai hub is very busy because of all the PPE that's being shipped from that region to the response. Our supply colleagues here, we are around 400 working here in Copenhagen, but we are joined by a valuable network of fantastic colleagues around the world. We are 1,000 all in all in the supply community. And this global network, working with partners on the ground, makes it possible for us to reach also really hard to reach destinations with life-saving supplies. And this also includes one of the products that we're talking about today, which is the RETF, the ready-to-use therapeutic food. So this little sachet is a life-saving peanut-based product, and you can actually give it to a child at home, which saves also both time for the family, but also they don't need to be in the hospital. Now, this product used to be produced by just one supplier in France. And the supplier said very proudly to us, listen, we can actually produce about 60 tons of this for you per year. And we said, great, but think bigger. We need so much more. So over the years, UNICEF has worked with the supplier to increase the supplier base and work with the market. And because of our procurement capacity, we've been able to expand. And we've been able to expand our supplier base by by over 20 suppliers, and many of them are in sub-Saharan Africa, where this product is used most. So this is really good for the economy, the local economy, because it creates jobs. It's also good for our environmental footprint, because you don't have to ship the supplies very far, and it's good for children because we are now able to procure 30,000 tons of RUTF a year. So as you continue your virtual journey beyond our premises here in Copenhagen, I hope you will enjoy seeing our operations. And I want to thank you so much for all your support that helps us keep sending supplies to reach children and give them the best start in life.
Thanks, Heidi. That was really, really interesting. You know, Communities in sub-Saharan Africa frequently face famines, I think, as many of you have seen on TV, but you may be surprised to know that rates of malnutrition can also be very high here in the Pacific. In Papua New Guinea, close to half of all children are stunted. And stunting is when a child misses out on a nutrient-rich diet. And of course, sadly, the effects are irreversible. So it's really, really important to make sure that children get this diet early on. Children who are stunted are more likely to contract infections like pneumonia, like diarrhea, and stunting affects their cognitive abilities, their abilities to do well in school, their abilities to deliver and contribute as much as they possibly can to their communities. Let's cross to PNG, where you see how UNICEF is supporting malnourished kids with ready-to-eat food or with Plumpy Nut. It's a life-saving peanut paste full of nutrients, full of vitamins, and it tastes really, really, really good.
Hi everyone, welcome to Papua New Guinea. My name is Noreen Chambers. I'm the communication specialist at the UNICEF country office here in Papua New Guinea. Today I'm going to take you on a short guided tour of the 6 Mile Urban Clinic in Port Moresby, the capital city of Papua New Guinea, where health workers are doing a fantastic job to address malnutrition here in the city. Let's go and meet Sister Stokes. So we're here in the nutrition clinic at the 6 Mile Clinic, and I'm going to hand over to Sister Stokes, who's going to talk about the nutrition program here.
So every day children are coming for well baby. So when they come, the nurses screen them. They weigh and they check their weight, how they are doing. And during that time, they also identify the nutrition, the malnourished cases. But the very sick ones, they send them, refer to Port Moresby General Hospital.
My name is Sister Tobias. I'm working at 6 Mile Clinic. We have a nutrition day once every week. It's Tuesday. So now we are going to weigh the child. Okay, the baby's weight is 6.9. Okay, find a depression there. That's 12 centimeter. That's the mid upper arm circumference. So that's moderate. The baby's length is 70 centimeters. Okay.
Thank you.
Up in there.
Baby now.
Igat planti all good lo kage inside lo sla packet. So every time lo kage you must give him this la. Most peanut butter. Okay. You press him na. Give him lo baby. Oh, baby like him penis. Okay. Oh, good boy. Our target weight is 7.2 to 7.5.
His current weight is what?
6.9.
6.9, okay. Sister, maybe you can just explain to me a little about how COVID-19 may have affected nutrition services in this clinic.
Yeah, I think it affected because the girls were not seeing many patients during that time because of manpower shortage, manpower problems. So they were more concentrating on COVID. So some of the activities like nutrition, they were sort of scaled down.
So now we're going to cross over to the UNICEF office in Port Moresby and welcome Margaret, one of the nutrition specialists who works in the clinic you just saw. So thank you so much for joining us, Margaret. Can you hear us okay, Margaret? Can you confirm that you can hear us?
Yes, I can hear you loud and clear.
Wonderful. So we've just visited a 6 Mile Clinic in Port Moresby, and I can see a lot of the work that you do involves mothers bringing their children, some who are crying, some who are much better behaved, some who are hungry, some who just want their checkup and want to see their friendly nurses. But can you walk us through some of the work that UNICEF does to prevent malnutrition occurring in the first place?
Yes, and thank you. Good day to everyone. And many children and families in PNG are hungry, and you can hear it from the screen, what have been shown. And this is particularly due to some drought. When crops are limited, there is not enough variety of food that children can have. So many of them tend to have one type of particular meal that leads to malnutrition. And children end up by not taking the right type of food. It is really, really important for us to get the children to have the right type of food. And many of our work here in the PNG office is to do more on prevention and awareness, and also supporting the health patient. That's just what you have seen. For prevention, we start to advocate more on the importance of children having the right start from the time they are born. We try to encourage the health workers to train the mothers to do more on breastfeeding, and also give the right type of information to the pregnant women. And many of the issues we have is many mothers do not have the right type of information on infant feeding practices.
Margaret, let me interrupt you there because that's a lot for us to digest all at once. But let me bring you back to another question, something we saw you doing. You're using the MUAC, the middle upper arms circumference, that piece of paper. Walk us through what that actually does. It seems like just a piece of paper. Can that be useful? What does it actually do?
This is what we use, this tool that we use, and that is to measure the mid-arm circumferences to find out if the child is well nourished or not. And if the line is on red, that shows that the child is severely malnourished. And if it is on yellow, it indicates that it is moderate malnourished. And if it's on green, the child is doing very well. So what we do is, if they're in between yellow and red, we get them to go on the therapeutic diet, which is the RUTF and the peanut paste. And that is supplied to the patient directly. And the mothers do take them to their homes and they feed their children.
But you mentioned this peanut paste. When I was a kid, we were always warned not to bring our peanut butter sandwiches to school because other students could be allergic to them. Isn't that an issue there? Or don't you find kids being allergic to peanuts?
In PNG, I would not say that they are allergic because of the limited resources in having high protein diet. This is one of the best solution, I would say, to treat children with malnutrition. And the peanut paste is mixed with milk powder, vegetable oil, and vitamins that is enriched to help the children even when they are undernourished. This is a very good product or paste that can be given to children, and we use that for malnourished children.
And just another really basic question that's really, really helpful. But what do people usually eat? What do kids usually eat in PNG? Walk us through the average diet, because I don't think everyone knows exactly what that would be.
Thank you. That's a very, very important question. And for PNG, I would say that one of the daily diet that most people eat, especially in the remote and some who migrate to town, the stable diet is the common diet that they normally eat regularly. And when they keep on eating that kind of a diet, that leads to malnutrition. And what we are trying to do here is to advocate so that they can have more variety of diet and not to have one type of particular diet on a long time that can lead to malnutrition.
Yeah, I think that's a really, really important part of the question there. I know people have been wondering about what does UNICEF actually do to prevent malnutrition? How do we make sure that kids are eating the right things? And I think you've touched on that. Can you walk us through a little bit about the communication role? How you get messages across to mothers and on what they should be feeding the children and when they should be feeding the children and when they should be breastfeeding and when they should move on to other complementary foods?
One of the important messages that we drive to whole mothers is through community platform. We do more advocacy and we deliver more posters to the communities trying to get mothers understand what we are trying to bring across, and also to train the village health volunteers to go out into the communities and train other women or other mothers. And one of the things we do is do cooking demonstration using locally available food. And that is where we will try and address more on mothers to know the importance of feeding the children with the right kind of food.
You know, you've talked about the importance of locally grown food, but that also brings up another question. I've been to PNG, and I think many of the people who are joining us online know that there's so much fresh fish available, and there's so many wonderful local fruits and vegetables. So if that's the case, why aren't children getting the nutrition they need?
That is when we find that many of them do not understand the importance of feeding them the right type of food. That information is missing, and we really want to drive that messages to all, to the general population to understand the importance, why they have to feed the children with the variety of food. You're right by saying that there are lots of fish and fresh food available, but the information is not there. So that's where we're trying to give them the information they need so they understand the importance of feeding the children with the right type of food, using different variety, diverse food.
Yeah, I mean, I guess mothers are the same around the world. All of us want to take the easy way out sometimes, and it's easy to get the cheap noodles from the shop rather than bother to make the wonderful local dishes that you're describing. But that indeed is not the best way to go. And another really important question that's come up as well. You know, it's not obvious why people would want food made of plumpy nut, food made of peanuts. Can you tell us why peanuts are so effective?
Peanut is peanut is available in our country in PNG, but the, 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 some of the reason why our people cannot access is some of them cannot grow the peanuts in some parts of the country, and also you have to have money to buy those things. And one of the challenges we have is people cannot afford to buy many of those things we have just discussed.
And I guess I mean, peanuts, of course, are very nutrient rich, and they have a lot of calories. And most importantly, plumpy nut tastes really, really good. I mean, kids like it, and if kids like it, they're going to eat it. And if they eat it, they'll get better. I think that's really something to keep in mind. It's a really simple solution and a really effective solution. Margaret, I know you've got a lot of work that you've got to do. We'll let you get back to work, and really, really appreciate you talking to us. But I think it's important to know that COVID is really a sharp reminder of the importance of vaccines, importance for us to ensure that children are well immunized. And we know that vaccines are essential for keeping children healthy. We, as UNICEF, vaccinate nearly half the world's children each year. It's a massive job. It's a job that's only possible through the cooperation of our logistics teams, our health teams, and the work of thousands of health professionals and volunteers and managers all around the world. We're really determined to reach every child with life-saving vaccines and to make sure we can reach every remote corner of the world. I see some of our Rotary friends on the call, and it's wonderful to have our friends from Rotary here. Rotary has been a really important partner of UNICEF around the world. They've helped UNICEF deal with issues like polio, and they've done wondrous work in helping us get the vaccines to children all around the world. We now have a partnership to immunize 100,000 children across the Pacific against 3 childhood diseases with the support of Rotary. And I really, really want to take this occasion to thank our colleagues from Rotary for the amazing support they've provided to UNICEF, the amazing volunteer work they've done, and amazing technical support they've provided us. And let me just also talk a little bit about the environment we're operating in here. Sometimes we don't realize just how big our Pacific neighborhood is. It's an area made up of some 660 islands stretching out across about 17 million square kilometers. It's an enormous amount of land and water combined. The combined equivalent of the US and Canada is just absolutely massive. So our immunization teams travel often for weeks by boat. They travel overland, they travel across mountains. It takes forever to reach kids. And what you're seeing behind me is another innovative approach. Here, our teams with UNICEF are using drones to deliver vaccines to remote islands in Vanuatu. And this is really interesting because vaccines are difficult to transport, and they need to be kept cold. They need to be kept in a very narrow range of temperatures between 2 degrees and 8 degrees from the time they're manufactured to the time they're delivered into the arm of a child. And Vanuatu is really hot. It's a really difficult place to deliver vaccines. It's mountainous, it's full of rough seas, cliffs. It's probably one of the most difficult environments you can imagine. It's made up of about 80 islands stretching across the Pacific. There are very few roads and really, really steep mountains to climb. About 20% of the children in the country, about 1 in 5, don't get their vaccines because it's so difficult to get to health centers. It's so difficult to get vaccines to children. So what you're seeing is how we're using drones, and this vaccine delivery covered the case you're seeing here, some 40 kilometers of rugged terrain from Dillon's Bay to the west to Iramongo Island to the east. Really, really difficult terrain. You're seeing some 13 children who were just vaccinated, and a number of pregnant women as well being vaccinated to prevent them from getting all sorts of diseases. So let's also move on to the Solomon Islands and learn more about our immunization work there. Thanks.
We're here with Gladys Hub, our UNICEF supporter. We're at Visale Rural Health Clinic. We're going to look at how they provide services for children and women and the malnourished kids. So they are taking the weight of the baby.
Baby's a little bit irritated.
Yeah, a little bit irritated.
Weight is around 8.7 kilos,
Okay.
which is underweight for the age. She's telling the mother that the weight now is lower than it should be. She's counseling her on what to do to improve the weight.
She's explaining that the baby is due for 1 year vaccination, and then they also receive vitamin A and deworming. So they're about to vaccinate baby Dennis with measles rubella vaccine at 1 year. Dennis is getting his vaccine. Good. She's just explaining that thanks to UNICEF and Gavi for the fridge support, which was installed last year, and they really enjoy the fridge. It's good. Particularly, they can freeze ice packs. These are ice packs used to package vaccines in the vaccine carrier.
The Rota vaccine is used for giving it to the child, help their immune system. It's caused diarrhea.
Oh. Well, diarrhea is one of the leading causes of child mortality in the Solomon Islands. And the rotavirus vaccine was just introduced this year. So this clinic is very critical and crucial. It's located at a very important point. And then around this clinic communities, we have some clinics, Selwyn on this side, We have Tamboho on the other side, Kohi as well. So sometimes those clinics, maybe there's no staff or it gets closed down. This clinic actually serves this, and luckily they have materials to work with, tools to work with. Thank you so much for the hard work.
On average, how many children would come in for their vaccinations here?
About 50 children.
Daily. Oh.
Just coming from a pharmacy background, considering that vaccines need to be at proper storage, how does UNICEF help the country to maintain this storage requirements?
You can see these are special fridges for vaccines. So UNICEF helps in procuring and delivering and installing a lot of these fridges.
Alright, so we have just seen baby Donald get weighed. He is 11 months old and should be roughly around 10 kilos, but now he's only weighing 6.7 kilos. And so it's very important that he comes to this stage where they do counseling.
So just counsel the mother regarding the low weight, and she's going to prepare the baby to the management of acute malnutrition clinic. He also identified that there's vaccinations that the child gets, and the mother explained the reason that she stays very far, so she couldn't come. So now the child is going to get vaccinated and also get reference for the management of malnutrition.
So the baby missed a few of his vaccinations. So today we're doing Penta, IPV and PCV vaccinations to catch up. And then after 4 weeks he'll be coming back for his next dose.
OPV vaccine. Sorry, Donald. And it's been seen by the nurse to follow up based on the weights that was taken, and they identified counseling it.
Every information about the baby is available. Yeah. How can we feed the baby? 1 to 2 snacks. Crispy or no lonely. Banana, melon.
Nurse has identified that the baby is getting 3 meals a day, but possibly not enough for what he should be getting, and she's advised the mother to at least increase it up to 4 meals a day and have snacks in between the meals. And we're about to give RUTF for the baby to taste, and that's something that the baby will take home to help increase the baby's weight.
Donald is testing the RUTF. Mother is happy. Baby is happy too.
So it's very important that we correct the baby's weight before baby reaches 2 years old to prevent stunting. Stunting is very prevalent in Solomon Islands, where 1 in 3 children.
I'm glad to see the nurse is using her training to properly counsel the mother on the effects of malnutrition. Yeah, well done.
So now that while you were watching those videos there, we had a couple of really interesting questions coming in. Somebody asked us, so how can a country like PNG, facing COVID, the threat of COVID, get the vaccines they need? I thought that was a great question because it's really, really critical. It's no secret that it's really hard to get the best vaccines quickly. That's where UNICEF and our partners like WHO and the consortium called Gavi come into play. So UNICEF is working to procure vaccines for some 92 countries, including PNG. Once they get qualified, and making sure that the right vaccines get to PNG as quickly as possible. Obviously, we need to make sure that the vaccines are qualified, and to make sure the vaccines are safe, and to make sure that the vaccines are effective. And we look to our partners, our friends from WHO, to make sure that pre-qualification happens. Then we're working with multiple airlines, multiple logistics providers, our very well experienced logistics teams, our teams from Copenhagen, to make sure the vaccines get there as quickly as possible. Our goal is to make sure those most at risk get the vaccine first. So first, we want to make sure that the healthcare workers and others who are most at risk get vaccinated to make sure that health centers can continue to respond as they should. And then we want to make sure that others who have diabetes and other people who may be at risk get the vaccine. It's a gradual process, of course, to make sure everyone is vaccinated, but we need to target the most vulnerable first. We're already working on it. We've been hard at work with the leadership of government and hand in hand with our bilateral partners, governments of Australia, other technical partners, our friends at WHO, our friends at Gavi, and we're confident that we'll be able to get vaccines to PNG very quickly. It has to go through the regulatory process. It has to go through a number of other hoops, but they'll get there, and we do see light at the end of the tunnel. But let's go on now to Solomon's and meet Ibrahim and Gladys. And remember, you can ask any questions you want to ask in the chat box. Ibrahim and Gladys, can you hear us? Are you there?
Hi, Sheldon. Yeah, we're here.
Great. I'm glad you're there. I'm glad you can hear us. We hear you too. Maybe I'll ask first, Gladys, if you can briefly introduce yourself and tell us a little bit more about your work with UNICEF and why you choose to work with UNICEF and support UNICEF.
Thank you very much, Sheldon. Hi, everyone. I'm Gladys Habu. I am a UNICEF Pacific supporter. I'm very grateful to be on this virtual field trip. The major part of my role is to help in championing the stunting reduction advocacy here in Solomon Islands through our first 1,000 Days of Life campaign. So we've been doing that through various different roles, such as providing awareness, community visits, posting on our social media platforms. And I'm also helping to support other UNICEF program efforts as well that are all aimed to promote well-being of our children. I am very passionate about helping children and giving back to the community, making sure we guide them so that they become productive citizens in the future. And UNICEF has provided me with this great opportunity, and therefore I willingly and wholeheartedly decided to be a UNICEF supporter in that way.
Gladys, you've been really amazing. You're a tremendous celebrity. Everybody knows who you are, and you've really managed to get out into all corners of the communities, to talk with mothers, to talk with families. Can you tell us a little bit more about what you're seeing? What do you see as some of the bigger issues that families are putting on the table for discussion? And what are some of the biggest issues facing children in the Solomons?
Yeah, thank you. I guess there are a lot of different challenges that many children and families here in Solomon Islands are facing. Just in the villages as well, the access to healthcare is still very limited. People have to travel long distances to reach not only clinics but schools as well. So that has been really difficult, and we're grateful that UNICEF is able to come in and help to bridge those gaps and help our children to be able to access this more. The other thing too, stunting here in Solomon Islands is really prevalent. We've got 1 in 3 children who are stunted, and therefore it's very significant that UNICEF and all other volunteers help to reach as many communities as possible, provide awareness to help our children understand and our families understand the importance of proper nutrition, exclusive breastfeeding, and those sort of things. But the other thing too, which I've also seen in my recent trip to the Malaita province, is seeing the connection climate change has with nutrition. So it's not only our health that is affected here, but also tying in climate change, sea level rise, limiting our land space for gardening. That's also impacting our families a lot. And because of that, nutrition status of not only adults, but children as well is really poor. Yeah.
Yeah, thanks, Gladys. And again, you do amazing work. Thanks so much for all your support and all your community outreach. It's really, really critical. Ibrahim, I have a question for you. We just met baby Dennis, who was receiving his first year vaccinations for rubella and for measles. Can you tell us a little bit about how far baby Dennis had to go? How did he get to where he needed to go to get that vaccination?
Thank you, Sheldon. Yes, baby Dennis actually came far. He came from the island across, which was about 2.5-hour boat ride. So it's really, with the sea, very rough. So it's really challenging. Most often we have health workers going out to conduct outreaches in those remote areas. So those are some of the things we help them to plan. But sometimes the parents and caregivers go out to do their errands to the garden. Perhaps they're not around, so sometimes they have to take the boat or take a walk for an hour or so down to the clinic to get vaccinated.
Wow, not an easy process. It's amazing that that mothers are willing to do that, and I think that really says a lot about the importance of getting the messages out, the importance of talking about and making sure mothers and communities and local leaders understand the importance of vaccination and antenatal health and the importance of visiting a clinic. I had another question for you too, a more technical question. We've seen and talked a lot about supplies like plumpy nut. So how much of RUFT or plumpy nut does a child need to regain health? How much you have to feed a child this, and is that alone necessary to get kids back to health, or other interventions also needed?
Yeah, thank you, Sheldon, for the question. Absolutely, we need other interventions. RUTF alone will not address the nutrition issues. Perhaps we've noted that malnutrition in the Pacific and of course globally happens together with other issues. We have micronutrient deficiency happening. So we also try to address the micronutrient deficiency like iron, anemia, zinc, iodine. Those are some of the deficiencies that also happen with the larger micronutrient deficiency. But in terms of the plumpy nuts, the baby children usually need about 6 to 8 weeks, sometimes even up to 3 months of daily plumpy nuts. So that's a lot of plumpy nuts. And in the Pacific, a lot of governments depend on UNICEF to supply these plumpy nuts and to help them forecast, procure and distribute down to the facilities. Yeah.
Yeah, that's really helpful. I have another question, or another question's been posed to us in the chat box. And that's the question about how do you get things done at the local level? And I think it's really important to emphasize that it is government that is responsible, and local authorities really play a key role. But could you walk us through who UNICEF works with at the local level and who our local partners are?
Thank you, Sheldon. Yes, at the local level, as you said, primarily the governments are responsible, but we also try to see how we work with community groups, church groups, local NGOs to try to see services are extended. For instance, we have some partnerships in some of the provinces here in Solomons where those communities are expected or are equipped to work with their local health facilities to see that outreaches, fixed clinic sites actually happen to help them with referrals and supplies. So those are some of the things we actually do. In terms of mapping out, there are historically communities that are very hard to reach. Particularly, we have a lot of islands in the Solomons, 992 islands. So we try to map out through the process of micro planning those particularly difficult terrains and islands and try to make sure that plans are kept in place to see that outreaches and mobile clinics go down there to deliver services to the communities.
Thanks, Ibrahim. That's really helpful. We've got another question for Gladys. So Gladys, are you still with us?
Yeah.
Wonderful.
Thank you, Sheldon.
Gladys, another question for you. There are a lot of partners out there, a lot of worthy causes. Can you tell us why you chose UNICEF of all the organizations out there? Why did you choose UNICEF to work with?
Thank you so much, Sheldon, for your question. As I said before, I'm very passionate about helping children and helping guide them to have a productive future, be productive citizens. And UNICEF, being the number one sort of organization that's supporting children all around the world, provides a really good opportunity for me to do that. Just ensuring that children have access to water, to good sanitation, go to school, be able to grow up in an environment that is safe for them, to me means a lot. And I want to be able to be part of that as well. And so when the offer came out from UNICEF, I was really happy to take it on board. And with the sort of leadership skills that I have, my ability to empathize and communicate with different groups, especially children, I love children so much. I just want to be able to share love and light to them through this. And I believe UNICEF provides this wonderful opportunity for me.
Well, thanks, Gladys, and we're really, really pleased that you've been able to work with us and have chosen to work with us. We agree that we're a good partner to work with, and it's really great to have you on our team. We had got another question too from colleagues, and that was, how has COVID forced UNICEF to change the way it works? And maybe I'll answer part of this and then ask Ibrahim to ask you to answer how it's forced you to change the way you work on the ground there. So here in Suva, as a manager, I don't think there's a part of how we operate that's remained the same. It's forced us to be far more innovative. It's forced us to really look at how we can provide the best possible support to our government counterparts and our local counterparts who really do the heavy lifting on the ground. How do we use technology to get training out to our partners? How do we use technology and video and some of the mechanisms we've put in place in the past? How do we enhance it to use it to monitor our support on the ground, to ensure that the tent that we think we delivered to community A is actually going to community A? How do we work with other local partners too, to make sure they can support us to support local communities? So in many respects, it's made our bonds even tighter. Ibrahim, any perspective from the ground, from what you're seeing and what you're doing on how COVID has made your life different?
Yes, sir. Thank you, Sheldon. Absolutely. COVID has made things a bit difficult, particularly the human resource and the focus of government has shifted from routine programming to COVID. But of course, we continually look at the data to make sure that we guide the government to make an informed decision, not to forget the routine programs like the malnutrition clinics, the vaccinations. We make sure that we continually support and advise the government to focus on that. But in addition to that, we try to also adapt or get some innovative solutions. For instance, we have the Healthcare on Air. It's a radio training for health workers, just to make sure that health workers in the remotest parts are trained on safe healthcare service delivery using the PPE, personal protective equipment, just to make sure that if we have community spread, it wouldn't be so deadly. In addition to that, there are clinics, of course, we know that are very crowded. UNICEF, we try to support them with tents as part of crowd control, and also support them with hand washing facilities at a lot of the clinics and schools. Those are some of the things we've been trying to do to adapt.
No, thank you. Really, that's a very good answer. And healthcare on air is a really good example of what we're doing. Of course, we use healthcare on air to keep communities safe from COVID, but we're using it for other purposes as well. Really, to reinforce the work, the basic public health work that health workers around the Pacific are doing, and we're adopting it in all 14 countries. Each country using it slightly differently, and we're using very different mechanisms to get it out to communities. We're using the internet, we're using radio, but that's a great example. But I'm really conscious of your time and the time of our colleagues who have joined us online. I really want to thank all of you for joining us today, and really a big thank you to our colleagues and friends in Copenhagen, our friends in Solomon Islands and PNG for spending time with us and allowing us into their communities to take a look at their work. And just a reminder as well, if you're able to contribute to the work, our work for children, as you saw on the ground there, it's almost Christmas. No gift is too small. Think about UNICEF. Think about the work that UNICEF does. Think about the communities you saw and the children and baby Dennis that you saw in our talk today. And think about all the work that you could be doing with us. We visited 2 health centers today. Not all families have the means to travel to a health center. So to finish the trip today, we're going to meet a community health worker that conducts outreach services to remote communities, reaching the hardest to reach, reaching all of those children. So best wishes from Suva, and thank you.
Name blow me, Paul Maisela, me on Falahel Boka, lo Solomon Islands. Waka blow me important role when me save give him law of the community and through educating okata mami about him breastfeeding, with him nutrition. 1 in 3 children have being stunted due to malnutrition and frequent illnesses. Most pekinini okata stunting hemi by some lead him to low learning block at low schools and hem by garem to okata risk for the pekinini for garem okata siki lo later life. Hem too wakablomi for preventing na okata this fella ota sikia. Biggest challenge blomi lo community na is the remoteness lo ota clinic hem stay far. And we have to spend 2-3 hours for travel by boat for go look at the villages. One of me really enjoy lo wakablomina is when time me go look him any picking anywhere him stunted. When him improve, him make him happy. Mommy him take him in information good and him carry him on what now. Me give him through advice and him resolve him baby him from stunted him grow healthy.